When people talk about the history of medicine, the story usually begins in Europe, ancient Greece, Rome. Then the slow march through medieval ignorance into enlightenment, antisepsis, anesthesia, and finally modern science. Africa, if mentioned at all, is placed outside that story, cast as a continent of superstition, ritual, and guesswork. But that narrative collapses the moment we look at the evidence. Because African medicine was not fantasy. It was observational. It was empirical. And in many cases, it worked. In southern Africa, Zulu healers practiced a form of wound treatment that shocked European observers. South African writer E.A. Ritter described a procedure in which healers boiled Jimson weed and mixed it with urine deposits from rock rabbits, creating a liquid antiseptic. That mixture was then pressure squirted through a reed tube into deep gashes and open wounds. The injury was sealed with leaves. This was not symbolic medicine. One of Ritter's own friends survived a leopard attack in 1910 because of this treatment. A man mauled by one of Africa's most lethal predators lived because the wound was cleaned, disinfected, and protected. That is medicine. Long before germ theory, Africans understood something crucial. Disease spreads. Anthropologist Iowan Lewis documented that traditional African medical knowledge included isolating patients with infectious illnesses. Smallpox inoculation was practiced in multiple parts of Africa. Somalis, through careful observation, understood that mosquitoes were connected to malaria, long before Western science confirmed it. This knowledge didn't stay in Africa. In early 17th century Boston, an American minister named Cotton Mather questioned an enslaved African man named Onesimus about smallpox. Onesimus explained that as a child he had undergone an operation that gave him something of the smallpox, but not the disease itself. The result? Permanent immunity. Europe celebrates Edward Jenner as the father of immunology. But generations before Jenner, Africans were already practicing it. The difference is not discovery, it's recognition. Surgery is often portrayed as a European invention. Romans, medieval surgeons, barbers with knives. But surgery also developed independently in Africa. In Nigeria, among the Yoruba, the practice of bone setting was passed from father to son and survived into the modern age. A medical study published in 1980 found that Yoruba bone setters understood the classical signs of fracture, swelling, pain, and loss of function. Their splinting methods closely paralleled plaster casts used in modern orthopedics. Yes, there were limitations. No x-rays, no anesthesia, risk of infection. But these were the same limitations endured by patients in London, Paris, and Philadelphia until the late 19th century. African surgery was not backward. It was historically normal. In Uganda, medical knowledge extended even further. British colonial official Harry Johnston described a treatment for pleurisy, an inflammation of the lungs that causes severe chest pain and breathing difficulty. The treatment? A hole pierced into the chest to release trapped air. The wound was dressed with butter. Within days, patients recovered. Johnston also noted something that challenged European assumptions even more. Uganda had no professional medicine men. Instead, they relied on women doctors. British observers often mocked traditional healers. But when it came to surgeons, their tone changed. Anthropologist John Roscoe wrote that surgical skill among the Baganda had reached a high standard. Bone fragments pressing on the brain were removed. Patients survived. Men whose stomachs had been ripped open in battle had calabash gourd shells inserted to hold organs in place, while the flesh was stitched over them. The Ikoi people of Nigeria used the same procedure. British officials personally observed patients who fully recovered and returned to hard labor. This was not luck, it was technique. In 1879, British medical student Robert Felkin witnessed a C-section among the Ganda people of Uganda. The woman was anesthetized with banana wine. She was restrained. And then something extraordinary happened. The surgeon washed his hands. He washed the patient's abdomen. First with banana wine, containing alcohol, then with water. This was antiseptic practice, and it occurred just 2 years after Joseph Lister introduced antisepsis to London hospitals. We may never know how long these surgical practices existed before Europeans witnessed them. A century, 2 centuries, more? What we do know is this. Across Africa, medicine was built as a system, based on observation, experience, and results. Wounds were cleaned because infection killed. The sick were isolated because disease spread. Surgeons washed their hands because it worked. When Europeans witnessed these practices, they didn't deny them, they documented them. So the question isn't whether Africans practiced science, it's why that science was written out of history. And once you see the evidence, the old narrative becomes impossible to defend. Africa did not wait for modern medicine. They built it.